So today I'm going to talk about some of the work that we've been doing at HIM to kind of move an agenda forward of centering the margins and what that looks like. So the Volunteer Professional Counseling Program was the first counseling program at HIM, and that program leveraged volunteers, primarily retired social workers who wanted to do more kind of clinical work, and they were like, I'm kind of bored in retirement, so I'm going to do this. Some of them were psychologists who were just interested in giving back to their communities. Some of them were clinical counselors, similarly interested in working in a gay space. They never had that opportunity, so they wanted to volunteer and do that. So we offer kind of brief solution-focused interventions. The habit is to cluster the programs around the center. Interestingly, the way I'd like to frame this for you is actually that the gravity is lightest in the middle of the center of that circle. And yet, as you can see, there's people mapped out all around the circle, but the programs tend to be clustered towards the middle. But we know that there is a margin, that for many different factors and many different reasons, the people, based on their being marginalized, whether it's income, poverty, developmental disability, physical disability, invisible disability, gender, mental health status, it could be the color of their skin. We know that those factors contribute to marginalization, and yet for some reason the programs still tend to be clustered towards the middle, essentially positing that all the people on the margins have a longer way to walk to get to the middle, against a higher pressure of gravity, which is pushing them to the outside. The counselors were saying, why is it that I'm seeing clients who make more than me per year? Good question. We were hearing feedback from other sources, from other communities saying, we need space. We need to be recognized. We need to be seen and have space that's unique and created for us. In an effort to kind of not disrupt what we'd already created, we remapped the programs. We created a fee-based program. The HIM Helps program actually we just give them our space. The counselors get our space if they charge a reduced rate to clients. These are competent counselors who've been vetted by myself through various different methods. We don't really control their practice, but we do kind of know who they are. And it focuses on that medium to high income bracket, which we assessed in Vancouver was between $35,000 and around $55,000 to $60,000 per year. It's an expensive city. So we created that program, and there was immediate results. Within a month, wait times dropped in the free program, the volunteer program, which now centers marginalized groups, to about 4 to 6 weeks wait instead of 16. We're estimating a 300 to 500% increase in total clients seen throughout the year. Essentially, what I want to leave you with is the idea that as programmers, as people in community-based organizations, it's your responsibility to move your programs.